rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Today, I saw a patient who had recently been diagnosed with metastatic testicular cancer. Before starting first-line chemotherapy, we needed to determine his prognostic group. Let's take a closer look. Our patient is a 29-year-old man with a non-seminomatous germ cell tumor arising from the testis. Staging investigations revealed retroperitoneal lymph node and pulmonary metastases. Fortunately, there was no evidence of liver, bone, brain, or any other non-pulmonary visceral metastases. His tumor markers were measured immediately before starting chemotherapy. His AFP was 999 nanograms per milliliter. His HCG was 4,999 international units per liter, and his LDH was 1.4 times the upper limit of normal. Let's assess this case using the original 1997 IGCCCG Prognostic Classification Calculator in the OncoToolkit. First, we'll select the tumor histology. This patient has a non-seminomatous germ cell tumor, so we'll choose NSGCT, or mixed germ cell tumor. Next, we'll select the primary site. The tumor originated in the testis, so we'll choose testis. Now we'll indicate whether non-pulmonary visceral metastases are present. Although the patient has pulmonary and retroperitoneal lymph node metastases, there is no liver, bone, brain, or other non-pulmonary visceral involvement. Therefore, we'll select no, lung and slash, or nodes only, or no, NPVM. Next, we'll enter the tumor marker values obtained immediately before chemotherapy. The patient's AFP is 999 nanograms per milliliter. His HCG is 4,999 international units per liter. His LDH is 1.4 times the upper limit of normal. Once all the required information has been entered, click Calculate Score. Here are the results. The calculator classifies this patient as having good prognosis according to the original 1997 IGCCCG Prognostic Classification. The updated 2021 NSGCT cohort outcomes associated with this category show a 5-year progression-free survival of 90% and a 5-year overall survival of 96%. These figures represent cohort-level outcomes and should not be interpreted as individualized survival predictions. To understand how the result was generated, expand how this result was calculated. The Clinical Summary tab displays the patient's final prognostic category. Next, select the Detailed Model Math tab. For patients with NSGCT, the calculator evaluates 4 key factors: the primary tumor site, the presence or absence of non-pulmonary visceral metastases, and the 3 serum tumor markers: AFP, HCG, and LDH measured immediately before chemotherapy. Therefore, the patient is classified as good prognosis. You can click Copy Result to copy the assessment for documentation or discussion. To save this assessment, enter the patient's name and click Save. Previously saved assessments can be accessed from the Saved Results panel. Next, let's scroll down to the Reference Data section. Here you'll find the original IGCCCG prognostic categories, together with the updated 2021 cohort outcome data. These references provide the evidence supporting the classification displayed by the calculator. Below that, the clinical workflow section explains when this calculator should be used and how the results should be interpreted in clinical practice. This calculator is intended for adults with metastatic seminoma or non-seminomatous germ cell tumors immediately before first-line cisplatin-based chemotherapy. It provides standardized prognostic classification to support clinical discussion, patient counseling, and clinical trial stratification. However, the prognostic category should always be interpreted together with the patient's overall clinical condition and should not be used alone to determine an individual treatment plan. The IGCCCG Prognostic Classification Calculator provides a standardized way to estimate prognosis using tumor histology, primary tumor site, metastatic pattern, and prechemotherapy tumor marker levels. For more oncology calculators and clinical decision support tools, explore the OncoToolkit. Thanks for watching, and I'll see you in the next clinical case.